You're watching Eye on Africa. I'm James Creedon. These are our headlines from across the continent this evening. The president of Madagascar is promoting a herbal infusion as a treatment for COVID-19, but the World Health Organization has cautioned against its use. We'll take a closer look at the controversy. We'll also bring you a report from DR Congo about a severely overcrowded prison in the capital, Kinshasa, where a COVID-19 catastrophe is feared. Human Rights Watch has sounded the alarm. We'll talk to their Central Africa director. And our reporters in Benin have been looking at how COVID-19 restrictions have led to extreme hardship for many poor families, with their sources of income drying up amid the crisis. Thanks for watching Eye on Africa. Now, it's a herbal infusion that has been touted as a miracle remedy for COVID-19 by the president of Madagascar. But the World Health Organization says clinical trials have not yet confirmed its effectiveness. Despite that, the drink has been distributed across Madagascar and indeed to other countries on the continent. Laurent Berstecker has more on the story.
It's been touted as a powerful cure against coronavirus by Madagascar's president. COVID Organics, or CVO, a plant-based infusion made in Madagascar, has begun to spark interest and controversy in Africa and beyond. On Thursday, the World Health Organization called on Malagasy authorities to take the product through a clinical trial.
We would caution and advise against countries adopting a product which has not been taken through tests to see its efficacy against COVID-19.
The beverage is a herbal infusion containing Artemisia, a plant with known medicinal properties, often used to treat malaria patients, and which is widely cultivated in Madagascar. Yet despite President Andry Rajoel's claim that it can cure COVID-19 in days, no scientific study has yet proven the plant's efficacy against the virus. This hasn't stopped Malagasy authorities from organizing nationwide distributions of COVID Organics, while other African countries, such as Niger and Guinea-Bissau, received their first shipments this past week. The likes of Senegal and the DRC have also procured samples in order to conduct further research into this so-called miracle cure.
Now to the Democratic Republic of Congo next, where there is growing concern about the safety of prisoners due to the spread of COVID-19. More than 100 cases of the virus have been reported in Kinshasa's Ndolo military prison. Human rights groups have warned about a potential disaster. Our correspondents Clément Bonnereau and Juliette Dubois report.
Media access to Kinshasa's prisons is now denied, but this video filmed by inmates bears witness to the harsh living conditions inside. Makala's central prison is home to more than 8,000 prisoners, 5 times its original capacity. Some detainees told us about their daily lives.
Un dortoir qui peut contenir 15 personnes. On y loge 100 personnes. Il y a même les gens qui n'ont pas même la place où s'allonger. Ils passent la nuit assis, d'autres même debout.
Overcrowding is not the only problem. Access to water and food is difficult. According to the UN, at least 46 inmates have starved to death in Makala since January.
On s'est disputé une demi gobelet de fungulé, les haricots préparés avec du maïs, tu manges ça, après tu dormais, le matin tu réveilles encore affamé.
In a report published in April, Human Rights Watch says the spread of coronavirus poses a major risk to the lives of Congolese detainees. More than 100 cases of COVID-19 have already been confirmed at Ndolo military prison in Kinshasa, and the epidemic threatens to spread to other detention centres across the country.
Comment vous voyez-vous que des gens peuvent lutter pour prévenir le coronavirus dans cette façon? S'il y a même un cas constaté dans la prison centrale de Makala, ça serait une catastrophe nationale.
Since a state of national health emergency was declared in March, authorities have released more than 2,000 detainees. The government says thousands more could follow to avoid a major health crisis.
L'ambition est vraiment de désengorger ces prisons et permettre ici à ces Congolais susceptibles de bénéficier de la mesure de grâce, de la libération conditionnelle ou de la mise à liberté provisoire, d'en bénéficier.
Most Congolese detainees have never been convicted. Some have been recognised as innocent but remain in prison. Many are still awaiting trial.
Okay, for more on that story, we can talk to the Central Africa Director for Human Rights Watch, Lewis Mulch. Thank you, Lewis, for talking to us on France 24. The images there are quite shocking, really. You can see completely overcrowded prison cells. 15 cells made for 15 people with 100 people crammed in. You can't even lie down. This is about as bad as it can get, is it not, in terms of conditions in prisons?
It really is. First of all, thank you for having me. What the COVID-19 pandemic has brought to the light is the overcrowded and unsanitary and just abysmal nature of the prison system in the DR Congo. This is a system that has been neglected for decades. And as your report highlighted, you have hundreds of people crowded into spaces built for just a few dozens. And so the concept that a pandemic could have an outbreak in that actual prison is just, well, for us, it represents a ticking time bomb.
Now, overcrowding, I'm imagining that it's not necessarily the first thing that could be resolved in this particular situation, but we're also hearing about appalling sanitary conditions. There was a complimentary report that I read in La Libre Belgique, a Belgian newspaper, talking about 3 toilets for 500 detainees. So, and also a problem of nutrition. So, do you think that what should be tackled first to improve the situation for these prisoners is what I'm asking, seeing as overcrowding, I would imagine, is not the first thing that could be resolved.
Well, there's a number of things that can be done, but to your point on nutrition, as I said, the pandemic is just bringing these issues to the fore. But in January and February, we had over 60 detainees die in the DR Congo of malnutrition. So this is a serious problem. This issue of malnutrition is a serious issue, completely unrelated to the pandemic. To your point, what can be done? There's a number of things that can be done. Number one, we have been calling for, we continue to call for, a mass evacuation of certain detainees. The fact is that 71% of detainees in the DR Congo, it's a shocking number, are in pretrial detention. That means they have not been before a judge. They have not been formally accused. And in many instances, these people are petty offenders. They need to absolutely and very quickly be released. Number two is that these prisons, and what this pandemic is bringing to fore, is these prisons are so under-resourced. The government of Congo, when they decide to detain someone of their liberty, they take on the obligation to care for that individual. And that means that these prisons need to have the resources by which to provide a basic level of food and a basic level of hygiene. And that's simply not being done. So it's high time that the government pays arrears and makes sure that these prisons have a basic level of money to get the job done.
Well, so perhaps there could be a silver lining to this COVID-19 catastrophe in the sense that it is bringing a spotlight on these appalling conditions. But do you think that things could move? Is there the political will to actually do something about this?
Well, on that front, we are cautiously optimistic. Just today, the Minister of Human Rights has said that they are in the process of preparing lists for prisoners for evacuation. We continue to push for this to be done quickly so that other detainees, guards, and the general population might not be infected if an infection has already broken out. As your report alluded to, in Ndolo prison, there's over 100 detainees who already have tested positive. But it seems that in certain ministries, this seems to be taken seriously. We at Human Rights Watch encourage these ministries to with all urgency, make these lists, who can be released, establish who can be released, and get them out as quickly as possible, thereby at least freeing up some space whereby some degree of distancing can be done and whereby the very bare minimum hygienic objects such as toilets and sinks that exist will be shared amongst less people.
Lewis Mulch, thank you so much for those insights into that situation in Kinshasa. Human Rights Watch Director for Central Africa. Thank you for talking to us. Now, many countries have issued stay-at-home orders amid the crisis, for example, Nigeria, but in neighbouring Benin, no such order was given. Nonetheless, much of the country's day-to-day life has grinded to a halt. For half the population living below the poverty line, the impact has been very harsh indeed, with informal work having evaporated in many cases. This report by Emmanuel Soji and Raphael Entale.
These volunteers here in the Cotonou neighbourhood of Togba are a welcome sight. They're responding to a call for help that was posted on Facebook by the neighbours of this orphanage.
Because of the coronavirus, they no longer receive donations and the children have nothing left to eat. This was part of the aim of our initiative, which was to feed or give a little to people who have lost their source of income or can no longer eat because of the coronavirus.
The institution's biggest usual donor is based in Italy, but since the country's become one of the European nations worst affected by COVID-19, contributions to the Beninese orphanage have dried up. It's been 2 months since they received funding. The shelter is one of several affected in Benin, and the children are put further at risk by the closure of schools in response to the coronavirus pandemic.
What we lack the most is food, because all the children are at home and are currently consuming a lot. Before, they used to go to the school canteen.
Poorer families are suffering too. Benin didn't issue a coronavirus lockdown, but communities have become more cautious about interactions. Opportunities and desire for informal work have dried up.
Avant, il se débrouillait, bon, il peut aller sortir, aller faire des jobs quelque part, mais actuellement, il ne peut plus sortir. Les gens ont peur de la maladie. Quand on regarde à la télé, on voit on dit le nombre de morts très élevé, donc ils ont peur de mourir.
This father of 5 had to stop fishing in the channel after it was banned. He's tried to make a living sewing instead, but isn't sure he'll be able to recover from the financial damage. While waiting to receive the emergency aid promised by the government, those in need have no choice but to rely on the generosity of their fellow citizens. Thanks to food donations, volunteers can help the most extreme cases, but the list is long and is likely to get longer as the COVID-19 fight back continues.
Malawi's Supreme Court has confirmed that a presidential vote held last year is null and void. The election had already been deemed invalid because of widespread irregularities. President Peter Mutharika was first elected in 2014. He has accused the courts of bias, which led to a backlash from the Supreme Court Chief Justice, who cautioned against making unwarranted allegations. A new vote is to go ahead on the 2nd of July. That's all we have time for in this edition of Eye on Africa. Thanks for watching.